Hi, thank you for tuning into Q&A. My name is Sarah Archer, and I'm joined today by Joe Cleary, who is a member of our partner management team. Joe is an expert in the Oracle Cloud healthcare space, and he's going to talk about how RFSmart can optimize your supply chain. So, Joe, thank you for being on our show.
Thank you, Sarah. Thanks for having me. Expert's a strong word, but I appreciate it. Thanks for having me.
Well, I think you're definitely an expert. We'll jump into some questions for you. Can you speak to some of the functionality that RFSmart can provide to healthcare facilities?
I think by and large, our solution, it tends to differentiate itself with our PAR and mobile PAR materials management functionality. So I think really, allowing staff to manage, count, replenish, and just transact on those expense locations in real time with a mobile device. For our customers in the provider space, managing materials and spending time in PAR closets and storerooms, is really not what they chose a career in the healthcare field. I think as they focus on patient care, really our piece, is, for them a means to an end for them to do their job. So anything that we can, as a solution do to help minimize touch points and increase accuracy and availability of materials, and ultimately, increase their trust in the supply chain so they don't have to concern themselves with anything but their day job, providing patient care is a win. That being said, I think, really our solution as a whole in the healthcare and specifically the provider space can be broken into kind of three buckets. I think the first being that PAR, mobile PAR piece I spoke to. And then there's also the mobile materials management piece and delivery. And when I say mobile materials management, this is really our Smart's bread and butter, and kind of our stronghold across, I think, all of our customers, across all verticals that we work in. So when you really start to think about those more traditional inventory-based operations, those transactions that happen across all, institutions and organizations that manage stuff. So you think pick, packing, and shipping and all that good stuff. In the provider space, they're just as relevant at their distribution sites or their warehouses or receiving docks that really allow, those transactions to be extended mobilely that, keep the business end of the network running smoothly, from an inventory perspective. So RFSmart really simply extends all that functionality you get as an Oracle SCM Cloud customer. So for example, we take our inventory cloud provider customers and simply allow for them to extend those transactions and capabilities onto a mobile device. And then finally, I think the delivery product, when we're talking specifically to our healthcare solution, that piece of our functionality is kind of the third bucket here. And it's really important and critical to call out just as a piece that we've added to instill some accountability and intention back into the delivery process for a provider. It's really no secret that many of our nation's providers, the receiving dock is most case the one-stop shop for everything coming into the network. So you could have fluids from Baxter or a vendor or a missed shipment that's intended for a certain area of the hospital or even someone's wine of the month is what we always say, coming into kind of that centralized dock. And quite frequently people are calling down, looking for their stuff. Vendors are, being contacted and asked for updates. And, there's the whole, it's at the dock, but it hasn't been processed conversation. And it just gets a bit chaotic because it's different than your traditional inventory-based operation. At a provider, there's things coming from all over. So, RFSmart's mobile delivery offering, it does a lot of things, but I think its most impactful value is just really instilling a level of accountability into the process. So whether that's cross-docking functionality or something as simple as capturing pictures at the point of receipt, just really increasing the digital, touch points at the delivery step in the process and feeding that back in directly to the Oracle Cloud environment. So a long-winded answer, but I really think from a healthcare perspective in our solution, it really boils into those three buckets: the PAR, so really your expense inventory, that mobile PAR management functionality, the mobile materials management, which is just really that more, bread and bones, inventory-based transactions, and then, of course, the delivery piece of it as well.
So as we film this, it's May 2020, and we're right in the midst of the COVID-19 pandemic. And so I think this next question is especially resonant. But Joe, what is the value that RFSmart can bring to Oracle Cloud healthcare customers?
So I think the biggest value that RFSmart for Oracle Cloud can bring to the provider community is just really, we always like to kind of slot it into these three words, but an increased accountability, visibility, and accuracy in the materials of a provider. So today, I think more than ever, really the critical importance of risk management and conservation in the provider supply chain, and really probably across all businesses, their supply chains. It's at an all-time high, and that's going nowhere but up as we continue to work to come out of this COVID battle. And so whether it's via federal regulation, I think, or simply increased awareness and preparedness in the provider ecosystem, I think from manufacturer to vendor to provider, every touch point where there's critical to life material, medicine, PPE, essential surgery, med devices, and materials at the par level that are just needed to give patient care, they're going to be pressed to change the way they do business, or at the very least reconsider how they manage their on-hand levels and mitigate risk in their supply chain as a whole. And let's call it what it is right now, but our business is not the focus right now, and we understand that as employees of RF Smart. The focus is getting our world healthy, I think, and safe to return to our lives. With that being said, there's a lot of talk about going back to normal. We can't go back to normal from this. As a community, I think we need to readdress how we do things, and public health is really atop that list. So bolstering your supply chain defenses, if you will, is a very real outcome. And I think with that comes the need for real-time visibility and accuracy for business decisions. And that's where holistic cloud-based solutions, come into play. So there's the plug, so RF Smart for Oracle Cloud, not top of mind for most of us right now. Certainly at the provider level, there's more pertinent discussions. But as we get out of this and start to move forward, there's a really important talk track, I think, that I know, we and Oracle as partners have for the provider system around that. So but crazy last few months. Hopefully we'll keep moving forward with all this.
I know that you've got countless stories of customers that RF Smart has been able to help and Oracle has been able to help, but can you just share a story of a customer in the healthcare space that implemented some of these processes?
One of the ones I always go to that really feeds well, I think, into our conversation around the importance of accountability in your supply chain and the importance of a strong trust from an organizational level in your supply chain is a couple steps back in my career. Early on, worked at a provider, visiting a provider where the trust in the supply chain was so low that staff was hiding materials in the ceiling tiles of their storing closets and whatnot, which I, at the time, of course, thought this was, crazy behavior, but realizing kind of more as I progressed over the years that hoarding of materials, within even storeroom closets, but even to, more serious med device materials was pretty common at the provider level, where the trust level in the supply chain is just very low. And it's not to speak ill of the folks managing that piece. It's just that there's almost a level of disconnect between the systems that order and transact for these materials and the folks that are using them. And when it comes to providing the best patient care, a lot of these individuals that are really doing that and they're on the front lines don't want to have to concern themselves with whether or not they're going to have the things they need on hand to provide care to a patient that's a need, and hopefully not, but sometimes in dire need. So I think that's probably the most telling story of kind of some of the situations at the provider level in their supply chain, especially when you talk about PAR materials. And that one stuck with me for a long time, just seeing that lack of connectivity and that trust, more or less, call it what it is, between the healthcare providers themselves and the supply chain.
That story is really crazy. It's such a testament to the reasons that healthcare providers need to be able to trust in their supply chain. And the mission here at RF Smart is to be able to transform our customers and change lives in such a way that they are able to trust that they have on hand, what they need. So that's great, Joe. Thank you so much for sharing that story. For those who are tuning in, if they want more information about our Smart for Healthcare, where can they go? What resources do we have for them?
Yeah, I think the best way to start, well, outside of, hopefully you guys will all get my email, but outside of, contacting Sarah or I or our team directly, I think, our website has a great really layout of our healthcare solution, our solution across the verticals we work in, which, as we've mentioned, is anybody who manages and wants to maintain and track stuff. But, specific to the healthcare world, I think it's a great place to start between the PAR management piece of our functionality and, like I said, mobile materials management, more your basic transactions and delivery. You can get all of that at rsmart.com. I also would think that there's plenty of resources we're more than happy to share across the board between the 13, 14, I think it might be 15 now, providers that we work with, and the 65 plus Oracle Cloud customers. We've always got good stories. So yeah, I'd say those two. Come to me or go to the website.
Well, thank you, Joe, so much for joining us today. For those of you watching, thank you for tuning in. We'll have links to our website and more information, including upcoming webinars down below. And thank you, Joe. We'll see you all again soon.
All right. Thanks, Sarah.